Hello, my name is Dr. Bukhari, and today we'll discuss about an antibiotic called doxycycline. We'll discuss about the mechanism and the most common side effects. And I will assume that most of us we are aware about the uses of doxycycline. So, in terms of mechanism of action, it inhibits protein synthesis by binding to 30S ribosomal subunit. So, it inhibits protein synthesis by binding to 30S ribosomal subunit. What are the common side effects? On the top of my list, it can cause esophagitis, and if it is severe, it can also lead to esophageal ulcer, and long term can cause esophageal stenosis. What is the mechanism of esophagitis? It can cause local caustic injury. Local caustic injury to the esophagus. Usually happen in 3 to 12 days after you prescribe doxycycline. Now, which patients are at risk of esophagitis, esophageal ulceration? The patient who have underlying history of stomach or esophageal disease like GERD. If your patient is not drinking a lot of water with doxycycline, they are at risk. Poor hydration. If they are taking the pill lying down or when they are going to bed, they are at increased risk. So you should tell your patient to drink a lot of water when they take doxycycline and stay in a stand-up position for at least 30 minutes after they take the pill. So these are the factors you should consider when you prescribe doxycycline to your patient. The second common side effect is it can cause photosensitivity reaction. It can cause photosensitivity reaction. So patients who are taking doxycycline, they are at increased risk of photosensitivity. Sunburn can happen. Hyperpigmentation can happen. Discoloration of skin. Discoloration of skin, especially in the sun exposed area. Especially in sun exposed area. So it can happen as early as less than 24 hours of taking the pill. So you should tell your patient to use, first you should tell them to avoid sun when they are taking the pill. Use protective sun clothing, protective clothing. And they should also use sunscreen. So these are the most common side effects you should consider when you prescribe your patient with doxycycline. Thank you very much. Have a nice day.